Every day, millions of women deal with the frustrations and worries of bladder and bowel leakage, and they don't have to anymore. Hello, my name is Ann Koveck, Senior Vice President of Clinical Services for InControl Medical. InControl Medical is the world's largest provider of FDA-cleared in-home medical devices for the treatment of bladder and bowel incontinence. We thought it might be valuable to you to understand the causes of these conditions and offer you a solution that solves the problem at the source, the muscle level. Let's begin with stress urinary incontinence, which is any leakage experienced when laughing, coughing, sneezing, lifting something heavy, or exercising. Stress incontinence is caused by weak pelvic floor muscles. The pelvic floor muscles act as a hammock across the pelvis, holding the pelvic organs in place and play a critical role in preventing bladder and bowel leakage. When the pelvic floor muscles are strong, they prevent leakage by applying pressure around the urethra, preventing leaks. Weak pelvic floor muscles cannot apply the pressure around the urethra necessary to prevent leaks. What causes weakened pelvic floor muscles? The leading causes are pregnancy, childbirth, followed by high-impact exercises such as running and jumping rope. So, how do you strengthen your pelvic floor muscles and eliminate stress urinary incontinence? Most women have at least heard of Kegel exercises developed by Dr. Arnold Kegel in 1948. In his paper, Dr. Kegel specified that women should contract their pelvic floor muscles against progressive resistance. If you go to a gym and lift a barbell with no weights, you won't build any muscle strength. If you lift a barbell with weights, you will build muscle strength. Sitting at a red light trying to squeeze the correct muscles is actually a wasted effort. Another common form of incontinence is urge incontinence, also known as overactive bladder or detrusor instability, which is that sudden, irresistible urge to use the restroom or getting up frequently during the night to urinate. 1 out of 2 women over the age of 50 suffer from urge incontinence, dramatically impacting their quality of life. This is also a muscle issue, not a weak muscle. Instead, it's an overactive muscle. Urgency symptoms are caused by the muscle surrounding the bladder, known as the detrusor muscle, contracts when it is not supposed to, causing those sudden, frequent urges to urinate. Medications are a commonly prescribed treatment for overactive bladder. Unfortunately, they are costly and studies have shown are effective in only 1 in 5 people, have unpleasant side effects, and 73% of people stop taking them in less than a year. The key to eliminating urge incontinence is to calm the detrusor muscle and reestablish that mind-muscle-nerve coordination so the muscle only squeezes when it is appropriate. The most effective option for calming and re-educating the detrusor muscle is called neuromodulation. Neuromodulation involves sending a low-frequency signal to the muscle surrounding the bladder, calming it, and over time, re-establishing the mind-muscle communication. Now, fecal incontinence, also referred to as accidental bowel leakage, is also a muscle issue. If the pelvic floor muscles or sphincters become weakened or do not function properly, stool can slip through the musculature and out the anal canal. An important part of the pelvic floor musculature is the puborectalis. This is a horseshoe-shaped muscle that wraps around the anal canal, creating the anorectal angle. Contraction of the puborectalis increases the acuity of the anorectal angle and maintains stool in the rectum. If the puborectalis muscle is weak, it does not effectively contract against the anal canal, and there is no angle to slow down the feces and no advanced warning to your brain. No warning and no slowing of fecal material results in incontinence. The last line of defense is the anal sphincter. The anal sphincter is a group of muscles at the end of the rectum that surrounds the anus and controls the release of stool, thereby maintaining continence. The external anal sphincter muscle helps maintain continence and keeps stool in the rectum. So you can see the benefit of strong pelvic floor muscles and a strong anal sphincter in maintaining continence. Now that we have explained that incontinence is a muscle issue, how does InControl Medical resolve incontinence? Over the past 8 years of research and development and more than 100,000 clients, InControl Medical introduces Attain. Attain is an FDA-cleared medical device designed to resolve bladder and bowel leakage in women. Attain does not require a prescription and is used in the privacy of your own home. So how does Attain resolve stress incontinence? By strengthening your pelvic floor muscles much faster and more effectively than you can do on your own. Attain utilizes a slender, inflatable probe that ensures a comfortable fit and, more importantly, provides the active resistance that Dr. Kegel called for. In addition, Attain uses mild muscle stimulation to make the correct muscles, even weak or atrophied muscles, contract around the inflated probe. The result? Strong pelvic floor muscles that keep your urethra closed and prevent any accidental leakage. As we discussed earlier, urge incontinence is the result of an overactive muscle. Attain utilizes a patented neuromodulation algorithm that sends a low-frequency signal to the detrusor muscle surrounding the bladder, calming the muscle and reestablishing mind-muscle coordination. Attain resolves bowel leakage by strengthening the pelvic floor muscles, particularly the all-important puborectalis muscle that maintains the anorectal angle that slows down stool and gives you warning of an impending bowel movement. Finally, Attain strengthens the anal sphincter, allowing you time to find a restroom. Attain is like a trip to the gym for your pelvic floor that results in strong pelvic floor muscles, a strong anal sphincter, and a calm, functional detrusor muscle. Attain is used just 10 minutes per day, 6 days per week, in the privacy of your home until incontinence is resolved. Once you achieve results, use Attain once or twice a week to maintain your gains. Don't let incontinence be your normal. Make it a thing of the past and use Attain. If you have any questions, you can call one of our female clinicians at 1-877-973-0422 or go to our website, InControlMedical.com. Thank you for listening.